Nichols, the Program Director and Clinical Supervisor for the Fresh Start program at ADAPT Integrated Healthcare. With a background in psychology and sociology, I've dedicated 11 years to working with ADAPT. I'm thrilled to share insights about our wonderful Fresh Start team today. In 2016, Advanced Health, then known as Western Oregon Advanced Health, recognized a critical issue in our community. They noticed that individuals coming out of residential care often relapsed upon returning home. This led the agency to research and gather data on how to address this issue. From the study, safe housing and transportation were identified as the major barriers to maintaining sobriety and addressing mental and physical health needs. With this information, Advanced Health determined that by addressing basic life necessities, individuals could more effectively engage in substance use disorder treatment and confront the underlying issues that contribute to substance use. Fresh Start was one of the answers to this. Initially, Fresh Start began as a modest operation staffed by just 3 dedicated members, managing 16 beds with the aim of helping individuals transition to long-term sobriety support within 3 to 6 months. However, this goal initially encountered significant challenges due to our area's lack of comprehensive medical and mental health programs, a gap ADAPT is working to help fill. With this new level of community support, we've expanded the program's duration to up to a year to ensure residents have stable medical care and a support system able to help them continue on their road to recovery. Our commitment to growth and betterment continues as we aim to create a life for our residents that's not only sustainable, but that's something that they can take pride in. This progress sets the stage for us to dive into the heart of Fresh Start, the wide range of services we offer that empower our residents to rebuild and take pride in their lives. For all our residents, we offer treatment groups, individual therapy sessions, and case management in collaboration with community partners like Coos Health and Wellness, Northland Medical Center, and the Waterfall Clinic. Additionally, we ensure connections with peer support and emergency on-call support to ensure that the residents always have someone to turn to. Engagement in social activities is also vital for recovery. We organize hiking trips, bowling nights, board games, movie evenings, yoga, art and music groups, gym sessions, and meditation. It's all about what the residents want to explore to get back the drive to engage with the world. We also assist with essential needs like providing transportation to primary care appointments, working with mental health counselors for cohesive care, and providing basic hygiene and cleaning supplies. And we also ensure residents have food until they start receiving SNAP benefits, also called food stamps, and collaborate with rental agencies to offer good renters letters, aiding them in securing housing after they graduate from the program. All of these efforts are rooted in building trust and meeting residents where they are so we can build a collective vision to guide them toward a life they can be proud of. For all our programs, we adhere to the standards set by Oregon Health Authority and Oregon revised statutes, maintaining compliance of both our housing and SUD treatment functions. This includes accepting referrals from all over. Most of our residents need to be based in Coos County or be chronically unhoused. Now let's talk about what an experience at Fresh Start is like. To start, entering our housing program requires residents to meet an ASAM 2.5 level of care and have reached 30 days, about 4.5 weeks, of verifiable sobriety. We receive referrals from various sources like ADAPT's own Crossroads Residential Treatment Program, city, county, and state institutions, Veterans Residential Services, the Coos Crisis Resolution Center, and more. Eligibility can also extend to those in our day treatment service who have stabilized and are ready for housing transition. Our intake process involves interviewing potential residents to assess their dedication to sobriety, and eligible persons scheduling move-in between Monday and Wednesday directly from their previous placement, which has proven effective for a smoother transition. In cases where residents need to visit their previous homes between residential discharge and Fresh Start housing entry, our dedicated peer support specialists provide transportation, supporting them to stay focused and avoid old habits. On move-in, residents receive a basket filled with their essentials for their room and initial food supplies to help with the transition to immediate 20 hours of weekly treatment service. One aspect of our services, our day treatment group, focuses on emotional identification, grounding skills, mindfulness, and art and music therapy, all integrated with dialectical behavioral therapy. Additionally, we offer on-site breathwork and mindfulness classes, as well as yoga sessions to further aid in their grounding and trauma release. Each resident regularly meets with their primary counselor and creates a personalized goals list with a peer, addressing aspirations like regaining a license, returning to school, and more. Additionally, we provide community transport and accompany residents to appointments as needed, and we utilize treatment workbooks for issues like anger management and codependency. Our emergency support is on call 24/7, especially with residents struggling with mental health crises. We also work closely with Coos Health and Wellness Mobile Crisis Unit for additional support. At Fresh Start, we're committed to meeting every need, whether it's through our programs or partnerships with community agencies. We've fostered a strong relationship with Coos Health and Wellness, particularly in facilitating a seamless transition into mental health services when needed. Additionally, our network extends to North Bend Medical Center, Bay Clinic, Bay Area Hospital, Coquel Wellness Center, and the Waterfall Clinic. This collaboration ensures a community-based approach in our case management. This approach allows our residents to receive consistent supportive messages from all those involved in their care to emphasize the importance of a united support system. Through regular case management and consultations with our community partners, we've seen a reduction in miscommunications and misunderstandings from our residents. This leads to increased trust in the care process and a smoother transition for our residents as they reintegrate into the community. We hope this has helped you get a better glimpse at our services at ADAPT's Fresh Start Day Treatment Program. Remember, if you ever need us, we're just a phone call away at 541-294-7001. To learn even more about Fresh Start and check out all ADAPT's other services, head to adaptoregon.org or follow us at AdaptOregon on social media. We look forward to welcoming you soon.